This is OHSU, shaped by leaders, pioneers, and those brave enough to take that first step. We carry the torch and shine a light on what is possible. We are a collaboration of disciplines, listening to one another, learning from each other. The OHSU Psychiatric Mental Health Nurse Practitioner Doctor of Nursing Practice is more than an opportunity to gain experience. It's your time to serve with a community of trailblazers and groundbreakers.
To me, it's the hallmark of a nurse, that we have that patient relationship as the core and the foundation of everything that we do. So I can't imagine care without it. And after years of caring for the people that were the most severely mentally ill, where you think, all you can do is give them a prescription, that's not true. I could, in a 30-minute visit, and our students can, form a relationship that increases the patient's desire to adhere to the treatment plan. I just find people fascinating. I find it interesting to try and understand where they're coming from. You find also when you work in this field that you yourself grow, because you spend so much time, understanding why behavior is the way it is, why things happen the way they do, why people behave the way they do in public, and how they behave in private. It's fascinating. It's really interesting, but at the same time, you can do more than the counseling role.
There's always just new information we're learning about the brain and about psychiatry and about just wellness, mental wellness. And so it's exciting that I get to always be reading and learning and finding new ways to support and help my patients. So I guess I feel I like it even more now, which is so cheesy. That sounds really corny.
I mean, certainly now that I'm doing it independently, it's probably one of the best feelings that you get when you see like, oh, this person is feeling so much better now. It was really a struggle there for a while, and now they're, kind of coming out of their shell again, or they're not psychotic anymore and they can think clearly again. Like, those are really cool things to see, and it's not always easy to get to that point. Sometimes you don't get to that point, but when it does happen, it's awesome. Think through what it is that you really want to do. It's a big life choice. I would certainly plug mental health. I think it's awesome. I'm very glad that I made the change to become a psych NP as opposed to one of the other advanced practice nurses that work in hospitals or other settings. So that, I think, if you love mental health, become a psych NP. You'll probably love it. And take care of yourself, cut yourself some slack. It's a long journey, but you'll get there. It takes time and patience and some inevitable frustrations along the way, but it comes along. And I feel like the program at the end of the day did a good job of getting us to where it needs to be. So I would recommend OHSU as a program to prospective students for sure.
I don't think I appreciated how close you get with your cohort and how much of a connection you build that just kind of sticks around. The faculty, I felt like, were very warm and inviting and supportive, but also it's a program where somehow they make it so that the cohort ends up being that way too. And so they facilitate this sort of connection between the cohorts so that you feel supported both from your peers and from your faculty.
I feel like we were very lucky with the group that we had. It was really pretty cohesive. We got along really well. We hung out outside of class pretty regularly. A good group of us did. So that was really nice. And, a couple of the people from the program, we actually still do, Zoom meetings every now and then and do like supervision groups just amongst ourselves to talk about cases and, support each other as we continue to learn.
You can find a lot of distance programs, but to find one that really builds a strong cohort and graduates students that are practice ready, that's I think our strongest point is that our students are ready for their first job. They don't need a residency. They don't need an internship. They may need someone to consult when they have a very complex case, but they're ready to go. We've had students graduate and move to rural communities with not a single provider nearby, and they said that they felt ready for that role.
The preceptor that I had out in the Dalles has been awesome, and I'm super glad that I had that experience, even though when I found out that I was going to be driving to the Dalles for clinicals, I was bummed. Initially, I was like, what? I got to drive to the Dalles? I do not want to drive to the Dalles for clinicals. And it actually turned into my favorite clinical experience.
At one point I was pregnant and doing the long drive, and it was like I still just like loved every minute of it. And so that was probably an aha, like, okay, I'm on the right track, you can do this.
Having faith in yourself, I think, will carry you far too.
If you don't have one yet and you're going to start the program, go pick a hobby and make time for that every week.
At some point, it's about the why you do what you do, as much as the how. We do it because we are bold. We do it because someone needs to make the difference, and we know we can make the difference because we already have. We welcome the curious, inspired, and those willing to be bold. This is OHSU.